Good day, everyone. Today, I will be reporting learners with difficulty hearing definition. Hearing impairment is a broad term that refers to hearing losses of varying degree from hard of hearing to total deafness. The major challenge facing students with hearing impairments is communication. Hearing impaired students vary widely in their communication skills. Among the conditions that affect the development of communication skills of persons with hearing impairments are personality, intelligence, nature and degree of deafness, degree and type of residual hearing, degree of benefit derived from application by hearing aid, family environment, and age of onset. Age of onset plays a crucial role in the development of language. Persons with prelingual hearing loss present at birth or occurring before the acquisition of language and the development of speech patterns are more functionally disabled than those who lose some degree of hearing after the development of language and speech. Since learning is acquired orally, many students' hearing problems have both experiential and language deficiencies. Because they do not hear environmental noises and day-to-day conversations, hearing impaired children miss a great deal of crucial information usually learned incidentally by non-hearing impaired children. Although students can overcome some of these problems to varying degrees through a great investments of time, energy, and effort by parents and educators, such deficiencies continue to be fairly common within the hearing impaired population.
So what are the causes of those learners with difficulty hearing? So here, some babies are born with hearing loss, which is known as congenital hearing loss. Many different things can cause this type of hearing loss, just like for example through our genes. In about half of all cases, the cause is genetic, meaning inherited from a parent. 50% of all cases of congenital hearing in children are caused by genetic factors. So an inherited hearing loss does not necessarily mean that one or both parents also have difficulty in hearing. In fact, about 90% of children with congenital hearing loss are born to hearing parents who may have passed on the condition by being carrier of recessive genes. So hearing loss can be inherited or can be caused by illness or injury, just like in prenatal stage of the mother. So the prenatal illnesses account of 5 to 10% of the cases of congenital hearing loss and include infections during pregnancy, such as rubella, known as the red rashes. Cytomegalovirus, this virus is spread through sexual or non-sexual contact. Herpes or toxins consumed by the mother during pregnancy or other conditions occurring at the time of birth or shortly thereafter. So babies born prematurely also have an increased risk of becoming hard of hearing or have difficulty in hearing. So the cause of child hearing loss can also be the drugs that the mother takes during pregnancy, known as ototoxic medications. These drugs are usually prescribed medications, including antibiotics and some pain relievers. Ototoxic drugs potentially cause damage to the auditory nerve or other hearing structures in a fetus. Other possible causes might be drugs or alcohol abuse by the mother or smoking during pregnancy. So prenatal causes make up to 5 to 15%. While in perinatal or postnatal stage, it is after birth. So the traumas to the head or childhood infections such as meningitis, measles, or chickenpox can cause permanent hearing loss. So certain medications such as the antibiotic streptomycin and related drugs also can be cause of the child's hearing problems. Ear infections like otitis media may cause temporary hearing loss or lead to permanent hearing impairment if left untreated. exposure to loud noise causing noise-induced hearing loss. Untreated, just like what I mentioned earlier, untreated infection in the ear can cause to permanent hearing loss, and also exposure to secondhand smoke or other toxins. So 20% of hearing loss occurrences are due to postnatal causes. So those are the possible causes of children's hearing loss.
Good day everyone. I am going to report about the types of hearing loss. There are several types of hearing loss, which means there are different ways to manage it. And it is very important to fully understand the So there are three main types of hearing loss. The conductive hearing loss, the sensorineural hearing loss, and the mixed hearing loss. Your child's audiologist helps you determine the next steps of the child's care or the management of the hearing loss. They can tell which type of hearing loss the child has. Conductive hearing loss is common in children. It can affect one or both ears. It occurs when there is a problem conducting sound waves easily through the outer ear canal, the tympanic membrane, or the middle ear or the ossicles. For someone to hear, sound signals must travel from outside the ear through the ear canal and eardrum into the inner ear. Conductive hearing loss results when sound becomes partially or fully blocked in the outer or the middle ear. It makes sound softer and more difficult to hear. This type is often temporary and may be improved with medical or surgical treatment. And once the blockage or problem is taken care of, hearing often returns to normal. If fluid build up behind the eardrum is the cause, a tiny tube may be inserted into the eardrum to help drain the fluid. Your healthcare provider, the doctor or the ENT, can tell you more about what's causing the child's hearing loss and how it can be treated or managed. The second type of hearing loss is the sensorineural hearing loss. Sensorineural hearing loss can affect one and or both ears. It is due to the problems with the inner ear or the damage to the hair cells or nerves inside the inner ear. In order to hear properly, these hair cells and nerves must process and carry sound to the brain. The brain then senses what we hear. When sensorineural hearing loss, the hair cells or nerves are damaged and do not send the signals needed for hearing to the brain. Sensorineural hearing loss is usually permanent. Treatment involves using devices that help the child hear as well as possible. These devices includes hearing aids, the cochlear implants, the ALDs or the assistive listening devices, or hearing assistive technology. Hearing aids are electronic devices that make sound better. The cochlear implants are surgically implanted that help the child sense sound. It is used when the hearing loss is too severe to be treated with hearing aids. The ALDs or the HATs use such as FM systems that require the person speaking to wear a microphone. ALDs allow the child to hear the person speaking without distracting the background. The last type would be the mixed hearing loss. The mixed hearing loss is a combination of conductive and sensorineural hearing loss. The treatment depends on the cause of the hearing loss, and a combination of treatment methods can be used to help the child hear well. Mixed hearing loss results to the damage to conductive pathways of the outer and or the middle ear and to the nerves or sensory hair cells of the inner ear.
Good afternoon, everyone. My topic is all about learning characteristics. Many students with hearing impairment can and do speak. Most of deaf students have normal organs and have learned to use through speech therapy. Some deaf students cannot monitor or automatically control their tone of volume of their speech. So their speech may be initially difficult to understand. So in order for them to understand the lesson, the teachers will give them lecture notes, handouts, and copies of electronic presentations so that they can study well in advance. Make time for face-to-face class at all times to allow for lip reading. So, if we have students cannot hear clearly, we must prioritize them. So, in the learning of students with difficulty in hearing, we must consider that the use of visual aids, chalkboards, overhead projectors, diagram, charts, etc. greatly assist students with hearing impairments. And third, in a group discussion, ensure that one person is speaking at a time. Point to the speaker of have speakers raise their hands. It may be necessary to repeat questions or comments so that the student can keep up with the discussion. So, in a group of discussion, one speaker must stand out to speak clearly so that everyone can hear. Then last, allow extra time with referring to written material since the students with a hearing disability must look at the material and then return his attentions to the classroom to keep up with the discussion. So, the teacher must have patience to the students who have the learning disability. And that's all. Thank you.